I think the thing that I've noticed, a lot of people talk about is, well, you know, you 36 to 37 weeks in terms of giving birth. Well, it's preterm and then it's term, and 37 weeks is term, and a magic switch changes at 37 weeks to make your baby mature. And I think what's really useful to understand is why I recommend, if a woman can cope with it, if her itching is okay, if her bile acids are low, if there are no other concerns, if she doesn't have diabetes, etc., why personally I would recommend giving birth at 39 weeks. And I think what's quite useful to talk about is the Americans have got a really good way of defining term, and this is the American College of Obstetricians and Gynecologists and their Society for Maternal Fetal Medicine have got a really lovely definition where they talk about 37 weeks to 39 weeks is early term, 39 to 41 is full term, and then 41 plus is late term. And what's really useful about that is that they present quite simple evidence about why a full term birth is better in the absence of any other factors that put your baby at risk or you at risk. And I think that's the big underline. You know, if you are coping well, it is better for your baby to be born at 39 weeks than 37 weeks, in terms of sort of the respiratory, particularly babies that have less problems with breathing. So if it's a choice rather than your body decides to put you into labour, or if it's, you know, a case of a doctor saying, I think we should induce your labour, and you're coping okay. And I think if you have stress levels up here, if you're not sleeping, that's not the same thing, because we know that adrenaline, steroids, they do cross the placenta. There is certainly an impact of particularly in this weather, it's horrendous. And I'm not saying that every woman with ICP should wait that long, but I think it is useful to know that 37 weeks is early term and 39 weeks is what we classify as full term, just to really understand what the slight pushback is. Not about money, it's not about what's cheaper and what people, you know, actually I'm very lucky in the NHS. I don't get pressures because I'm not in management about how much things cost. I want what's best for the patient that's in front of me. But in terms of individualising care, that I think was the one thing that I didn't really talk about last time that feels important.